sure that everything's good after your surgery that you've just had, okay? Okay, do you know your name? Do you know my name? Correct, Dr. Whisper, that's right. Do you know which hospital you're in right now? Okay, that's good. How is your mouth? Do you have a dry mouth right now? Okay, we can get you some water. Sure. Nurse, can we get some water for this patient, please? Okay, they'll come and grab some water and bring it to you soon. In the meanwhile, I'm just going to ask you some more questions. Do you remember your name? Now, do you remember which knee you had the surgery done on? Great, your memory's intact. That's great. Yes, it was a success. It went very well. So now that we've got you awake, I know that you feel a little bit groggy, but that's okay. You can go back to sleep soon. We're just going to go over a couple things to make sure that you're feeling okay before we let you go home, okay? Okay, so the first thing, I'm just going to take your blood pressure really quickly just to see how it's doing post-surgery, post-anesthesia that we had put you under on, okay? All right, here we go. It's a little cold, so I do apologize. So what I'm going to do is just warm this up a bit. Nobody likes a cold stethoscope, so. Okay, now that it's warmed up, I'm just going to can you lift your arm up for me? Just going to go right underneath your armpit there and have a listen. Okay, here we go. Ready? Okay, I'm just going to go in here. Okay. Can you hear that? No, it's not a plane. It's definitely your heart. If you can hear a plane, I think we need to do a little bit more investigating. Okay, well, your heart is stable in regards to the heartbeat. That's good. So now I'm going to be listening for your blood pressure. Can you just stick your arm out for me just like that? Okay. We're just going to go along here to your wrist area. I'm going to listen for your pulse through that area, not your blood pressure. I meant your pulse. Make sure in the radial arms that it's okay. So stick your arm out just like that for me, just like this. I'm going to put it right there, okay? Okay, stick your arm out. Okay. Yep, I'm hearing it. Are you hearing it? That's good. Okay, great. So you have a great heartbeat post-surgery. That's excellent. Now, just going to be going through a few things to make sure that your vision is good as well. So I'm going to cover one eye. You let me know how it goes, okay? Here we go. I'm going to cover your eye. Now, can you see me still? Great. We're going to do the other eye. Can you see me still? Great. It's got little holes in it. Can you see through the holes just a little bit? Just a titch. Can you see me? Okay. It was a trick question. You can see me just barely, though. Great. So your eyes are good. Now we're just going to follow along really quickly. Follow my hands, okay? Follow them. Follow them. Follow them. Follow them. Up. Sides. Great. Tell me when you cannot see my hands anymore. Okay, here we go. Great. And again. And again. And again. How many fingers am I holding up? How many fingers now? How many fingers now? And last one, how many fingers? Great. Your vision is intact. Again, a great means of success from a surgery on a doctor's point of view. I'm a doctor, so I definitely know what I'm talking about. Exactly. Okay, so now we're just going to go through your eyes still again, but we're going to be doing a color visual test. I know, can you hear those planes as well? Maybe there are planes outside right now. It's not just you, it's definitely, I think there are planes around the hospital right now. Okay, we've got our colors here. Tell me what colors you see when I bring them onto the screen. Here's the first one. What color is this? Excellent. And how about the second one? Great. And the next. And the next. And the next. Okay. And last just going to have a quick look inside your eyes just to make sure that they're dilating properly as well. Man, those planes outside, we need to have a conversation with those pilots. They're definitely ruining our exam here that we're doing on you to make sure that you're physically fit. Okay, now I'm going to go into your eyes, so can you look up for me? Up like that. Okay. Excellent, that's great. Looking up. Next eye. Looking up. Look down for me. Looking down, looking down. Next eye, looking down. Okay, now just follow the light side to side. Keep following the light. Follow the light. What circle? Oh, I just told you what it is. What shape am I making? Do you know that shape? Correct, it was a square. How about this one? Triangle, excellent. And this? Circle, good. Your eyes are fantastic. I'm just going to have a feel around your face, your lymph nodes, check your hearing, just to make sure that portion is good as well. Okay, so I'm just going to come into your, just the lower portion of your jaw here, so just don't mind me. A little bit of cold hands, I apologize. Here I come. Okay, can you feel that on either side of your jaw? You can feel that on either side of your jaw? Okay, how about when I come just underneath it? Can you feel that? Can you feel when I'm tapping? Excellent, okay. Just gonna come up alongside your ears here. Just on these areas here. Can you hear that? Okay. Which ear am I doing this in? And the next. Okay, how about now? And now. And now. Which ears were you hearing those in? If you said both, you are correct. I was doing them in both your ears. Okay, next I'm going to get you to cover your eyes. And we're going to do the hearing test one more time just to make sure that your ears are hearing properly. We need you to be able to leave the hospital with good sounding ears so you can hear that traffic or you can hear that dog barking. Okay. Okay, close your eyes for me. Now, what ear do you hear this out of? No looking. Okay, and again. Okay, and how about now? One more time. And the last one. Okay, great. So your ears are intact as well. Along your jawline, there's no swelling. Your trachea is intact, which is good. You need to be able to have that intact so that you can breathe and swallow. Because you're probably quite hungry right now, I'm going to assume. Yes, the surgery, it was 6 hours, but we had to do your knee. And it's just no ordinary knee. You have a bionic knee now. You can run that 100-meter sprint. No problem now. Okay, so how are you feeling for oxygen? Do you need any oxygen? Okay, we're going to test your breathing right now to make sure that that's okay, because when you leave the hospital, you need to be able to take deep breaths. Okay, so in and let it out. And in. Hold that breath and let it out. Keep letting it out. Was that easy to do? Great. I knew that you'd be able to do it, no problem anyways. Okay. Now, I do have another test that I would like to do for you. It's just how many circles do you see on each piece of these Legos? This is so I can test your depth perception in regards to what you see from far away, but also to see if you can count while visually looking at something that's quite small. So, here's the first one I'm going to do for you. How many circles do you see? Can you see that? How many circles? Did you say 6? Great. And the next one. Tell me how many circles you see. You can't focus on it, can you? I'm really sorry that your eyes are not acting as well as they should. Let's see, there we go. Did your eyes focus? focus. How many circles do you see? Does it get blurry as I get closer to you? Okay. Well, the correct answer was 8. Okay, and we'll do the last one here. I'm just going to do this one. You're already passing with flying colors as expected. So, how many? Man, I'm going to have a conversation with the airport authority after this. Those planes are just despicable. It really ruins the doctor-patient tests that we're doing here, so I do apologize. So, how many circles do you see on this object? Let your eyes focus on it. Okay. Did you say 4? 4 is correct. Okay. Now, before I let you go, you seem like great health. Do you have family here to pick you up? Do you have anybody to come pick you up? No? Okay. Well, thankfully, we have a bed upstairs that you can stay in tonight if you're still a little tired. Okay, and before I let you go, 5 more questions that I just need you to answer. Do you remember what you ate before you came in for surgery? That's right, you had breakfast because you were not allowed to eat before the surgery. That's right. It was a trick question and you did no problem on it. Now, the next one. Do you remember what car you drive or vehicle or mode of transport that you got here in? That's right, you were dropped off because you cannot drive after a surgery. Again, a trick question, but I know that you got that one right. Okay, and the third one. What type of drink would you like after to leave here with? You can pick any one and we'll get it for you. Remember that nurse at the beginning? Where is that nurse? She never brought you the water. Nurse! We'll make sure that she brings you anything you want when you leave the hospital. Now, that was my 3rd question. My 4th question. Now that the surgery is over, what are you going to eat? What is the first thing you're going to eat? Wow, that sounds delicious. As a doctor, I would really enjoy if you could bring some of that back. I don't get a lot of spare time to myself, so it's nice to be able to eat in between surgeries. And the last and final question, who are you going to recommend to come get another surgery from me? Let me know. I'd love to be able to help them out, make their lives better. So when you're done, when you're leaving this, let them know about it. Let them know I can help them. Create a better, relaxing environment for them so that they can live a better and healthier life. Okay. Now that nurse did come, but I don't think she brought you what you wanted. She didn't bring anything. I'll have to go give her a talk. Anyways, you have yourself a great night.